Colorectal cancer is the third most common type of cancer. Suppose you have any of the symptoms described in this video. It is best to consult a doctor. It may be nothing, but it's worth checking out and reassuring. This video covers colon cancer or the early symptoms of colon cancer. The risk of colon cancer increases with age. It can occur in young adults, but it becomes more common after age 50. These are the 9 common symptoms of colon cancer. Number 1. Blood in stools. Blood in the stool or blood in it may be a sign of colon cancer. Your doctor will send a stool sample for a laboratory analysis called a fecal occult blood test. Bright red blood in the stool usually indicates bleeding in the rectum or colon, which can be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Patients with hemorrhoids usually experience relapsing symptoms, but rectal bleeding due to cancer usually continues or worsens and is more likely to be painful. Number 2. Changes in stools. Stools can be very dark or even black and sticky. This may be due to bleeding from colon cancer. A rare narrow stool is probably harmless. However, in some cases, narrow stools, especially those that are pencil thin, may be a sign of a narrowing or obstruction of the colon due to colon cancer. Another condition that causes them to be smaller, taller, or narrower than normal. Irritable bowel syndrome also causes changes in stool consistency. Call your doctor if you notice a change in the appearance of your stool. Narrower than regular stools lasting 1 to 2 weeks or more. If bowel changes are accompanied by rectal bleeding or severe abdominal pain, call your doctor right away. Number 3. Rectal bleeding. Blood is usually bright red and sticks to toilet bowl water and toilet paper. Colon cancer often bleeds into the digestive tract. The stool may be bloody or thickened, but most of the time the stool looks normal. However, blood loss accumulates over time and can lead to a low red blood cell count anemia. The first sign of colon cancer may be a low red blood cell count on a blood test. Many of these symptoms can be caused by conditions other than colon cancer, such as infection, hemorrhoids, or irritable bowel syndrome. However, if you have these problems, it's important to see your doctor right away so the cause can be found and treated. Number 4. Anemia. Anemia is a deficiency of red blood cells in the blood. It can occur due to blood loss due to colon cancer. Symptoms of anemia include frequent fatigue, weakness, and shortness of breath. The skin may appear pale and pallor. One of the many symptoms and warning signs of colon cancer is anemia. Tumors can bleed because they have their own fragile network of blood vessels, and you may feel tired and weak because the tumor is bleeding internally. Characteristically, this tumor is extensive and may spread and go undetected. Even with signs of anemia, the stool may not be bloody because the blood dries before it leaves the colon. Pay close attention to symptoms and don't hesitate if they persist for more than a few days. Please make an appointment with your doctor. Number 5. Abdominal pain. A certain level of abdominal discomfort may be a normal experience. However, if you have frequent bloating, cramps, and gas, you are more likely to develop colon cancer. Abdominal or intestinal bloating, fullness, cramps, or pain may be symptoms of colon or rectal cancer. These are common problems that can be caused by many medical conditions, including diet-related gastrointestinal disorders, Crohn's disease, and ulcerative colitis. Number 6. Weight loss. Even with a normal diet, colon cancer can lead to weight loss. Alternatively, the appetite may be completely lost. Loss of appetite, or feeling weak are all possible signs of colon or rectal cancer, as well as many other unrelated conditions. These symptoms are related. Persistent diarrhea can lead to weight loss. Stomach pain and nausea can reduce your appetite and prevent you from eating enough to maintain your weight. All these problems can lead to debilitating as well as anemia. Number 7. Constipation. Constipation that lasts longer than a few days may be associated with colon cancer. Chronic or persistent constipation may even increase the risk of colon cancer. Constipation, defined as having fewer than 3 bowel movements per week, is one of the most common gastrointestinal complaints. However, constipation does not mean colon cancer. Diet changes, eating disorders, stress, dehydration, and lack of exercise can also cause constipation. Doctors generally recommend that if constipation persists for more than 2 weeks, see a doctor so that the cause can be determined. Number 8. Diarrhea. Persistent diarrhea is often a symptom of colon cancer. If you've had frequent diarrhea, you may be wondering what caused it. Overall, changes in bowel habits such as diarrhea may be a sign of colon cancer. Diarrhea is either due to a secretory process fluid loss from the tumor or due to partial obstruction and overflow around the tumor. It's important to remember that most cases of diarrhea are caused by medical conditions that are far less serious than cancer. Bacterial infections, food allergies, and contaminated food and water are among the most common causes of diarrhea. Number 9. Nausea and vomiting. Persistent nausea and vomiting for no apparent reason can be symptoms of colon cancer. Colon and rectal cancer are among the most preventable types of cancer if detected early. If you suspect something is wrong, see your doctor, as early detection is the best prevention. Nausea and vomiting can occur when a tumor in the colon or rectum blocks the intestines and prevents the passage of liquid or solid waste products or gases. Intestinal obstruction may also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting are symptoms of a variety of conditions, benign or serious. Seek immediate medical attention if nausea, dehydration, or vomiting persists for more than 24 hours. These are the common symptoms and signs of colon cancer. Remember to eat healthy food every day. We also publish a video on how to prevent kidney diseases and burn belly fat. I will leave the links below the description and comment section. Be sure to check them out. If you like our video, please don't forget to leave a like and subscribe.